Three more states now officially banning abortions as trigger laws take effect today. Idaho, Tennessee, and Texas are among the original 13 states with laws that were set to be triggered if and when the Supreme Court overturned Roe v. Wade. Well, since the ruling, at least 15 states have now ceased nearly all abortion services. Senior policy reporter Ann Flaherty, along with Texas abortion provider and co-chair of the Committee to Protect Healthcare's Reproductive Freedom, Dr. Bhavick Kumar, join me now. And let's start with you. A federal judge in Idaho, as we mentioned, actually put part of the state's ban on hold. So explain exactly what's going on.
So this is a very narrow win, Kira, for the Biden administration. This is the first lawsuit that they have filed since the Dobbs decision. And they said, look, there's this federal law that says if somebody walks into an emergency room, you have to care for them, whether they have insurance or not, and you have to provide them stabilizing care. Well, Biden interpreted this to mean that this would also apply to pregnant women who might be in need of an abortion. And his Health and Human Services Department put out guidance that says if you're a hospital, you have to provide abortion care to a woman who might need it. The federal judge in Idaho says, well, okay, we're going to let that stand. But the overall impact is that abortion is still at a near total ban in Idaho. So, and in 15 states, we've seen that abortion is on hold. So, you know, a very narrow win. This is not going to change much of the dynamic in the country, but it is a win nonetheless.
So, Dr. Kumar, with Texas's new law, the state now has 3 abortion bans on the books. This one makes abortion illegal at around 6 weeks and has no exception for victims of rape or incest. Many abortion clinics already stopped performing the procedure. So, realistically, how much of a difference will this actually make, you think?
Yeah, you're absolutely right. On the ground, things really won't change. The folks that have not been able to access this care in Texas will continue to not be able to access this care. But what this is another signal. It's another boulder, really, on the shoulders of healthcare providers who are trying to do what's best, especially in these urgent and sometimes emergent situations that may present in an emergency room. And rather than being able to provide that care, now folks are navigating the potential repercussions of providing that care. And with this latest trigger ban, we're looking at a physician or any healthcare provider potentially facing life in jail and a $100,000 fine for each abortion that they may have provided. So the way that folks navigate this and consider their options when talking to patients will just feel heavier, and we're going to see a worsening of this chilling and chaos effect that we've already started to see.
Right. And you know, we've talked about President Biden trying to help increase abortion access through executive orders. How effective do you think that's been? Is there anything else he can do?
Well, it hasn't. He hasn't gotten much traction on this. Of course, the Idaho situation was an executive order, and when the judge upheld it, it was only that narrow piece of it that's not going to impact most women. So, you know, of course, Democrats and progressives are very frustrated with the president right now. They want him to strike more bold action to expand abortion rights. I think there are a couple reasons why he's not. One is that, you know, he's limited in his legal options. There is no doubt about that. He doesn't want to rack up these legal losses that could tie his hands down later down the road. I think the other issue here is that he wants to spend his time and his focus on addressing the urgent needs of the vast majority of Americans. There's the number of abortions is relatively small. It's been falling since the 1980s. He's been focused on inflation, climate change, those big wins, but we'll see if he's got more of a legal strategy brewing.
I just want to follow up, Dr. Kumar, on something you just mentioned, and that's how this trigger ban allows harsher penalties. Like if you help a woman in Texas terminate her pregnancy, it could land you in prison and, as you said, pay a major fine. As a provider, how does that impact you personally and professionally?
Yeah, I mean, as a physician, you know, we go through years of training and, you know, sacrifice a lot in order to help people. And I think for whether it's me or my nursing colleagues or other folks that work in clinics, we show up to make sure people feel better, to make sure people are getting the healthcare that they need. And in these situations where we're instead having to navigate potential liabilities, go into prison, it weighs very, very heavy on us. And also, we're seeing the real people that are being impacted by this. And so it's very, very difficult to face this every single day.
Well, thank you for joining us, Dr. Kumar. I appreciate it. And always great to have you. Thank you both.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.